My name is Jim Garcia. I'm the CEO of Clinica Tepeyac, which is a community-based health center in North Denver. We're in the Globeville, Swansea, Elyria neighborhoods just north of downtown Denver.
Tell me the population that you all are serving.
So we were founded to serve a population that really had very few resources when it came to healthcare. So the population that we served when we were founded 23 years ago, and the population that we're serving now hasn't changed much. It's a largely monolingual, Spanish-speaking. These are individuals who, by and large, are undocumented. So again, that poses a whole series of challenges for them in terms of accessing medical care and to a much greater extent dental care and behavioral health services.
Before Clinica, where did this population get care?
You know, I would say they avoided getting care to a large extent, and then would end up in many cases in the emergency rooms. To the extent that they could get into a large system like Denver Health, they would try to get in there. But I think that presented its share of challenges just from a institutional standpoint, that they had a really difficult time navigating a large health system like a Denver Health.
What are the factors that inhibit them from getting better care than you've described?
Yeah, language is a big one. You know, just continues to be a challenge if you don't have someone that speaks the language and can connect with you on that level is the first barrier. But then I think much more so is just the whole cultural barrier that can be that's in place when someone's trying to access medical care. If there's not that language component combined with an appreciation for the person's culture, I think that creates a barrier to accessing care.
Talk a little bit about factors such as social status, economic status, education, and how that might affect this population.
And, the population that we serve is largely, they're working poor. So these are individuals who have limited education and, in many cases, struggle to navigate systems in general, not just healthcare, but just systems in general when it comes to basic human services. And so I think a lot of times they're relying on their children to help them navigate these systems, which is not ideal. And so, I think that is the population that we serve. And these are, I think, individuals that I think bypass other systems, healthcare systems, because they feel that connection that from a cultural standpoint, from a language standpoint, and I think just a basic human dignity standpoint. I think that's the big difference.
Where does Clinica get its resources to provide this care?
Support comes from the philanthropic community, so foundations. We every conceivable health foundation provides support to Clinica. We have contracts with health agencies, whether it be Colorado Department of Public Health or the city's HIV program. So in some cases, we have contracts with these different agencies to provide services to our population. We recently became a federally qualified health center last year, and so we're now seeing Medicaid patients, still a relatively small segment of our population. I would say 90% of our population is not eligible for Medicaid because of their documentation status. And so the vast majority of the patients that we still see are people that really have very few options for care. I think there's that misconception that with the Affordable Care Act, with Obamacare, that all the problems were solved. but that is definitely not the case for our population.
What does the so-called private sector, the traditional acute care population, the hospitals in particular, what's their view of Clinica?
Well, I think Clinica will be their first on their list in terms of a referral. So someone that, for example, that comes into the emergency room for care and needs follow-up care, they're going to give them a list of resources. And I think in many cases we're probably on the top of that list in terms of where they can refer a person to that came for care that was seen at an emergency room, but was going to need some type of a follow-up care, or was going to need a medical home. Then they would come to us.
So those systems are happy to know that you're available as a place where they can send patients that they can't treat or don't want to treat?
Would prefer not to treat. I mean, I think I would say that they're not, for someone who's uninsured and doesn't have any other type of payment other than self-pay, their preference, I think, would be to refer them to a facility like ours that can provide that level of care.
And so to what extent, if any, do those healthcare systems provide support in any form for Clinica? Because you're obviously taking on a responsibility, financial and care delivery, that they don't want to take on.
So I would say that from the point that we were founded, we were fortunate to have a partnership with St. Joseph Hospital, which is a Catholic hospital run by the Sisters of Charity of Leavenworth. There early on, they stepped up and became our hospital partners, so that when we did have someone that came to us that was beyond what we could provide in terms of the complexity of their medical issue, we would be able to have that option, and would still have that option to refer our patients to St. Joseph Hospital, and to a limited extent some of the other hospitals that we're working with.
So if there were no services or not enough services like Clinica to meet this population's health needs, it seems reasonable to believe then people are going to go uncared for, they're going to get sicker, there have to be impacts not just on them but on their family, on their community. How would you speak to that?
Yeah, I think someone with an untreated chronic health condition is that condition continues to worsen, and then they're in a position where they get to the point where they're so sick that they show up again at the emergency room, and where the cost of their care becomes just exponentially greater than if they were to find a medical home like a Clinica Tepeyac and get that preventative care and early on, as opposed to when it becomes to the point where it's much more serious.
Over time, as a population continues to be underserved, what are the impacts wider on the community, on systems? What it can't possibly flourish.
Mm-hmm. Well, yeah, I think people not getting basic health care, not only is it obviously it's a moral issue, but it's also a public health issue. People that aren't getting immunized, children that aren't getting immunized or vaccinated, it becomes a much larger public health issue that will have to be addressed if this population isn't getting the care that they need early on and in a preventative fashion.